Hello, everybody. My name is Zia Charbonneau, and today I would like to bring to your attention how inaccessible healthcare is becoming recently. The industry that should be about basic empathy and right of care has recently been taking a shifting towards a system focused primarily on profits and money-making. A study performed by the RAND Corporation estimated that low-income households spend an average of over 33% of their income on healthcare. Middle-income households spend an average of around 20% of their income on healthcare, while higher-income households spend an average of around 16% of their income on healthcare. Why is it that so many people have to spend so much of their money on basic healthcare? When is it going to come to a point where people just cannot simply afford it anymore? Well, it already has. Health insurance is a necessity for the ability to afford any type of medical care in the United States. Without it, even things such as a basic doctor's visit can cost well over $150. It might not seem as a super significant cost to some people, but for an American living at the current poverty level, that would mean they're spending over a tenth of their monthly income on one doctor's visit. 8% of people in the United States, per the US Census, remain uninsured. But why? The thing that's supposed to make healthcare affordable can actually be an extreme expense for a lot of people. The majority of uninsured people said that their reason for remaining uninsured was because of the high cost of insurance premiums. The average ACA marketplace insurer costs $560 a month. That's $18 a day. These costly plans are just projected to even increase more in 2026. If you look at the chart behind me, you can see that 66 of these insurers plan on increasing the rate 15 to 20%. Don't you think without the ability to afford healthcare or insurance, you'll be at higher risk for disease or death? Well, you are. A study conducted by Harvard University found that people without insurance have a 25% higher likelihood of death, all-cause death. That number can account for 45,000 additional deaths in the United States annually. That's enough people to fill an entire Yankee Stadium. The thing is, insurance companies still don't even cover all costs. In America, the average out-of-pocket cost per person is $1,425. Now, let me tell you a story. When I was younger, my mom had become extremely ill and needed extensive treatment. One day, I was snooping around, and I happened to find a bill for over $12,000. Now, although I had no idea how insurance worked or how much we actually paid out of that amount, if we paid any, but I was still old enough to realize that charging people extreme amounts for any type of medical care is not right. Now, I'm going to leave you with this. The United States is the only industrialized country in the world without a system of universal health care for all citizens. When do we draw the line of morals and ethics? When is it going to become just enough is enough? That's for the American people to decide. Thank you all. I hope you have a great evening. Thank you so much.